Dr. Kostakis again. Today's topic is, believe it or not, Alexander Graham Bell. You might say, thought you were a tooth doctor. Now you're going to do speech and hearing. No. The key of today's talk is listening, and more listening. Too many times, dentists have an agenda. They look at an x-ray and they say, I've got it. This is what the patient needs. This is what I'm going to do, and the patient's going to pay for it. That's not listening. That's cookbook. Dentistry is not cookbook. There's many variables to what patients can and will have done. One of them is finance. Another is time availability from work. Another is emotion. Many people want to buy cosmetics. They don't want to buy fixing a broken molar until it hurts. It's more exciting to have your teeth whitened than to have a root canal. I have to face that. So communication is key. Now, David Little is a very successful dentist and lecturer in this country, and he has broken down communication into 4 aspects. One is the dentist must inform the patient of the problem, identify the problem. Second factor, you try to tell the patient how the problem occurred. Give the patient an origin of the problem so that it can be avoided in the future. The third aspect of communication is implementing a solution. You as the dentist would correct the problem, make the mouth function again with complete comfort and without even a thought about should I chew on this side or not. And then the fourth aspect of communication is letting the patient know the consequences of delaying or foregoing completely this solution that the dentist suggests. Now, I would go beyond Dr. Little's theory. It's not theory, it's a very, very appropriate way of approaching communication. I have a 5th aspect to communication. Let's give the patient a way to anticipate the benefit of implementing the solution. It's one thing to say, if you don't do this root canal, you won't sleep tonight. You have to go beyond that. You have to give them the benefit of accepting the treatment, of following through. And that, I believe, is a great motivator so that patients will do what is best for them. Okay, so this is the model of communication. This is how it's specifically applied to dentistry. Now I'm going to give you a couple examples how it has or has not worked in my office. Next month I'm going to reach 25 years experience as a professional dentist. I've had my share of successes and a few instances where communication failed. And you as patients, potential patients, can gain confidence in the experience I've gained and my staff have gained through all of the years of experience. Most of the people in my office have worked with me for 10 years, and we know we can read each other's minds. That helps a lot. So one instance, a lady came in fully knowing that her 2 remaining lower eye teeth, canines, were shot. They were very loose in the jaw. They were supporting a partial denture, and she walked in resigned to the fact that she was going to have these teeth pulled. She asked me to save her some money and take out the teeth without taking x-rays because she didn't have a lot of money. She knew that they were a lost cause. And in my philanthropic frame of mind, I obliged her. I took out the teeth, never took the x-rays in order to save her money. Now looking back, I should have taken the x-rays and just not charged her. You're going to see how this came to haunt me. The patient went home now with an unsupported denture. These 2 teeth were not capable of supporting the partial denture because they were out of the mouth. So now the denture swayed like a boat on the high seas. It was very frustrating for this woman to chew. And so she came back to me and said, I never wanted to have those teeth out. Look what has happened now. I can't even chew my normal meals because the denture won't sit still. Why didn't you tell me this? She went beyond that and accused me of pulling two healthy teeth in her frustration over not being able to wear the denture. I knew it was time for those teeth to come out, but I couldn't prove to anybody because I didn't have the x-rays. So, bottom line, if you're going to communicate with people, it's best to do things the right way. It's very helpful to let people know what's going to happen, what could happen after dental treatment. Oftentimes, I won't just say we're doing a filling today. If I know that it's a deep filling, I'll warn the patient, you know, the heat from drilling on this tooth could damage the nerve. The old filling is so close to the nerve. You might need a root canal months down the road. And you need to know that as I'm starting this filling. This is the kind of communication that creates profits in business, as opposed to people that have to explain through the back door because they didn't let their clients know what could happen ahead of time. I like being a prophet. I'm going to tell the worst case scenario, the worst thing that could happen with dental treatment. And if it doesn't happen, guess what? We're all happy. There's no unpleasant surprises. Now, another emotional issue in dentistry is cosmetics. And it's important for myself, the dentist, and my staff to communicate to a patient what they can accept, what they can expect, as a final result of their cosmetic dental work. Now, I can't do like the movies and create an illusion, get magic to come out of the sky and say, look, this is your smile, and put it in the patient's mouth, and it's very rare that they could have a preview of what their teeth will look like, except for the fact that I use Night Dental Group, which is a fantastic professional laboratory in Oldsmar, and they will do on a plaster model, a replica of your mouth, they will add wax to the teeth on the model in order to simulate the appearance of your new teeth. This, in fact, is a preview of the final result. And you can have the confidence that the laboratory will produce this result, so you go home comfortable with the idea of tackling such a project. And then when the final result comes, you've already seen it on a model that you can touch and see. You can bring that model to your spouse at home, and your spouse can see, hey, this is worth the money spending. I like the way this looks. Wouldn't it look great on you? This is part of communication. It's one thing to take x-rays. It's another thing to show little videos. We all have computers in our offices. We can show videos that describe what a root canal is, what getting a wisdom tooth taken out involves. All these are communication tools, and it's important that you are able to perceive what will happen. Bluntly, it takes the fear out of dentistry. If we can take the fear and the worry out of dentistry, then you'll be much more comfortable coming to us and referring your friends and relatives, which is our goal. Another communication, and this is a very delicate topic, involves finance. A lot of people will go to medical offices, many businesses, they don't operate with estimates. I prefer to take a little bit extra time. We work with a lot of PPO dental insurance companies, and we go the extra yard. We will take a list of the work that we see you need for your teeth. We'll send an estimate to the insurance company and get approval for the major work, such as crowns and veneers and bridges. And the insurance company will list the benefit they will pay, and then separate that from the total fee so that you know what your portion is, what your responsibility is. Not every dental office will do that. In fact, we break down your copay for fillings, which is very unusual in the industry. Every appointment you come in to our office, you will have been communicated your responsibility as to the fee. That takes the surprise out of it. So we eliminate the surprise of pain, we eliminate the surprise of aesthetics that we're not ready to accept, and we eliminate the surprise of money. So your stress level can be greatly lowered. One rare occurrence that happens on weekends is a person's waiting for a permanent crown. They have a temporary crown. They're told you only have to wait 2 weeks and we'll get the permanent one in. See you in 2 weeks. Now, Joe Public would say, well, it's all done. You know, I won't have any problems. Wrong. If you eat something sticky, you can pull your temporary cap off. What do? Doctor's on the weekend. I'm not going to bother the doctor. I'll just keep it in my pocket, and we don't need it now. We're just going to wait for the permanent crown. Maybe the tooth has a root canal. Doesn't hurt when I drink cold water. I'll just leave the temporary in my pocket. Well, it's important for my staff and I to communicate to you, the patient, that teeth will shift when you don't have the temporary on. So it's important to push it back on immediately. Call me. If it's a weekend, most likely I'm home. If I'm not in town, I have the luxury of having a group of dentists that we all participate in an on-call group, so somebody is covering for me when I'm out of town. You have the opportunity to get the temporary crown re-cemented and keep the teeth stable so that the space doesn't get squeezed shut. Because maybe the permanent crown won't fit. So I have the obligation to communicate to you, get the temporary back on the tooth. Call us and we will find a way. Or if we're out of town, the on-call dentist will rectify the situation. Now, what about changes? Sometimes I'll do an examination and we'll say, I think you need a filling on this tooth. And when I drill the old silver out, there's a massive pile of mush underneath the silver, the amalgam. Well, I have to drill the cavity clean. Sometimes it gets very, very close to the nerve. Sometimes the nerve gets exposed while I'm cleaning out the cavity. Now all of a sudden it's a root canal and it's not a filling anymore. Well, communication is important between my assistant that's helping me chairside and the people that do the paperwork up at the front desk. When we send a claim to the insurance company, it's important that that claim is accurate. If we don't do the filling today and we have to schedule a root canal, and Andrea and Martha have to get that message from Anne-Marie, who's my assistant. So that change in plans has to get communicated. That helps things work smoothly for you. When you make your next appointment, you know that it's going to be for the right procedure and not just something that was cooked up a week ago. All of these situations take communication. My office isn't just about drilling and filling and billing. We work on communication so that your life is more relaxed. A lot of people enjoy getting their teeth repaired, beautified. That's our goal. We invite you to our office because we work hard on communication. Your goals become our goals, and together we'll achieve them.